Imagine that Mrs. Smith comes into your pharmacy. She's 70 years old and has a Medicare Part D plan. But she learned that her current plan will no longer cover her insulin in the coming year. So she's very confused and wonders, what should she do? Is there a better plan out there for her? As a pharmacist, is there anything that you can do to help Mrs. Smith? And yes, there is. And that's what we're going to be learning about in our class this semester. This semester, we'll have some Medicare outreach volunteer events. And at these events, you'll be able to get some real-life experience helping patients with this issue. So let's talk a little bit about these events. If you do decide to sign up for one of these volunteer events, there will be 3 stations at the event. The first station is the intake station. And at this station, you'll gather a bit of general information about your patient. Some of this information will be on their Medicare card. From their card, you'll want to find their Medicare ID number. You can recognize this number because it will end with a letter, usually an A. You'll also need to know the date that their Medicare Part A became effective, and this is also on their card. Some other information you'll need is your patient's date of birth, as well as their zip code, where they lived when they signed up for Medicare, and a list of their prescription medications. You'll record all of this information on 2 different forms. And these forms will follow the patient through all 3 stations. The next station is the plan comparison station. And what you will do here is use the Medicare.gov online plan finder tool to compare the cost of your patient's prescriptions at the pharmacy of their choice. And you can compare up to 3 different Medicare Part D or Medicare Advantage plans to find the one that's the best fit for them in the coming year, as well as enroll your patient in a new plan if they choose. The last station will be the exit interview station. And here, you'll make sure that all parts of the patient's forms are complete. And you'll also ask them a few questions to make sure they were satisfied with the program. Before you leave the event, please also be sure to fill out the student survey so we can get your opinions about the program. So these events are a great way to help our patients in the community in Auburn, as well as throughout Alabama. And I really hope to see you at a volunteer event this year. Thank you.